Hello everyone, and welcome. If we had to give a simple definition of constipation, it would be this. Constipation is a condition where stool becomes dry, hard, and difficult to pass, making bowel movements uncomfortable or infrequent. In today's video, we'll explain why constipation happens, how the digestive system is involved, and what the most effective treatment options are. Before we begin, don't forget to like the video and subscribe to the channel so this information can reach more people who may need it. To truly understand constipation, we first need a quick overview of how digestion and bowel movements work inside the body. Once food enters the stomach, it is broken down and mixed with digestive fluids, turning it into a semi-liquid substance. This mixture then moves into the small intestine, where most of the nutrients, such as vitamins, minerals, proteins, and sugars, are absorbed into the bloodstream. What remains after nutrient absorption is waste material. This waste is passed into the large intestine, also known as the colon, and this is where constipation begins to develop. The large intestine has two main functions. The first function is water absorption. As waste moves through the colon, water is gradually absorbed back into the body. The second function is movement. The colon uses rhythmic muscle contractions, called peristalsis, to push waste toward the rectum. At the end of the digestive tract is the rectum and anus. These are controlled by two important muscle groups, the anal sphincter muscles and the pelvic floor muscles. Together, these muscles keep the rectum closed until you consciously decide to use the bathroom. When the time is right, the brain sends nerve signals that cause these muscles to relax, allowing stool to pass normally. Constipation occurs when one of two main problems develops. The first possibility is slow bowel movement. When the colon moves waste too slowly, the stool stays inside the intestine for a longer time. This allows excessive water to be absorbed, making the stool dry, hard, and difficult to pass. The second possibility involves muscle dysfunction. If the pelvic floor muscles or anal sphincter become overly tight or fail to relax properly, stool cannot pass easily, even if it has reached the rectum. Several common factors can contribute to these problems. One major cause is inadequate fluid intake combined with a low-fiber diet. Fiber, found in fruits, vegetables, and whole grains, helps stool retain moisture and move smoothly through the colon. Another important factor is physical inactivity. A sedentary lifestyle slows intestinal movement, increasing the risk of constipation. Psychological stress also plays a role. Anxiety, tension, and chronic stress can disrupt the nerve signals between the brain and the digestive system, slowing bowel function. Certain medical conditions can also cause constipation, including irritable bowel syndrome, colon disorders, and in rare cases, colon tumors. We previously discussed irritable bowel syndrome in a separate video, which you can find linked at the end. Pregnancy is another common cause. As the uterus grows, it puts pressure on the intestines and pelvic floor muscles, making bowel movements more difficult. When it comes to treatment, the approach depends on the severity of the condition. In mild to moderate cases, constipation is usually managed with laxatives, which help soften stool and stimulate bowel movement. Increasing water intake, eating fiber-rich foods, and staying physically active are essential parts of treatment. In more severe cases, where hard stool becomes impacted in the rectum, medical intervention may be necessary. This can include enemas, either over-the-counter products or medically administered solutions designed to soften and break down impacted stool. Lifestyle adjustments are equally important. Drinking enough water, eating plenty of fruits and vegetables, exercising regularly, even simple walking, and adopting a squatting position during bowel movements can significantly improve stool passage. And with that, we've reached the end of today's video. If you found this explanation helpful, don't forget to like the video and subscribe to the channel for more 3D medical animations and educational content. Thank you for watching, and stay healthy.